Welcome, everyone. I'm glad you could join us tonight. My name is Mary Carnes, and I am an Assistant Director of Alumni Relations at PC. And I'm excited to have you all here with me tonight for what promises to be a wonderful event. A wonderful event in a time where we're all concerned about the vaccine and what it's doing in our lives. So this is, I've had the distinct privilege of working with Dr. Capel and Father Austriaco over the past several weeks to put this program together. And I'm excited that they're able to share with us their expertise and knowledge of their research within the field of science and how it relates to the COVID vaccine. A few housekeeping items. Our plan tonight is to begin with some brief introductions of our panelists. I'm going to be introducing our two regional volunteers who are with us tonight. And after those introductions, we'll ask both panelists to share a little bit of information with us about their research and the work that they've done. And then we're going to open it up to questions that you can address our panelists with. We encourage you to use the Q&A function and ask questions, and we will get as many of those questions answered as we can. And then hopefully we'll wrap up by 8. So without further ado, what I'd like to do is introduce our two regional volunteers who are with us tonight. Michaela Riskin, class of 13, and Casey Wheeler, also class of 13. They are from the Fairfield Alumni Network and the Boston Alumni Club, respectively. And they are going to join me in welcoming and introducing our panelists to you. So Michaela, I will hand it over to you.
Thank you, Mary. Good evening, everyone. My name is Michaela Tadajan Riskin. I'm class of 2013. I'm the lead volunteer for the Fairfield County Alumni Network. If you are a member of our network, you know that we were once part of the Westchester Alumni County as well, and we are now our independent alumni network. So very proud to be a friar in Fairfield County. I'm going to introduce Dr. Alexandria Capel. We're pleased to have her here with us this evening. She is a postdoctoral teaching fellow in the Department of Psychology at PC. She studies how to alter individual attitudes and beliefs. Specifically, her research focuses on anti-vaxxers, predictors of vaccine hesitancy, and how to change vaccine hesitant attitudes. She graduated from the University of Michigan with a PhD in cognitive neuroscience and has been at PC since 2019. She currently teaches a 2-part course titled Research Design and Statistical Analysis, as well as Intro to Psychology, which I took during my time at PC, as well as a seminar on psychology of misinformation, which sounds very interesting. So thank you so much for joining us.
Thanks, Michaela. My name is Casey Wheeler, everyone. Thanks for the intro, Michaela and Mary. I am actually a PC classmate of Michaela's, proud member of class of 2013, woohoo, go Friars. And I am representing the Greater Boston Alumni Council tonight. I help as a volunteer on that council and particularly with their social media blast. So thanks for everyone for following our Instagram posts there. But tonight I have the distinct pleasure to introduce Father Nicanor Austriaco, Order of Preachers and class of 2020 graduate, recent MBA graduate. Congrats, Father Nick. Affectionately known as Father Nick among PC students of many class years. Father Nick is a professor of biology and theology at Providence, and he has been at PC since 2005. Father Nick is a yeast molecular biologist who is developing a yeast delivery platform for a COVID-19 vaccine for resource-poor countries. He is also the lead investigator for the UST COVAX awareness team at the University of Santo Tomas in the Philippines. And his interdisciplinary team at the university is working to end the pandemic in the Philippines by raising vaccine confidence among Filipino people. His list of courses is taught at PC includes so many different options, too many to name tonight, honestly, but does include various levels of biology, genetics, ethics, and Western civilization courses, among many, many more. So thank you so much, Dr. Capo and Father Nick, for speaking to us tonight, and I'll turn it over to you.
All right, so I'm going to go ahead and share my screen with you all so I can give you a little bit of a more in-depth introduction to some of the work that I do. As was mentioned before, so some of the work that I study is on altering individual attitudes that tend to be rooted in misinformation. So I actually got interested in this in my graduate career at the University of Michigan. And one of the things that occurred during that time was that there was an outbreak of measles that was not only happening in the US, but also happening in other parts of the country as well, and in other countries as well. And one of the reasons why this increase in measles kind of took over at that time was because a lot of parents were refusing to vaccinate their children from MMR due to fears about the vaccines leading to autism. So based on that particular piece of misinformation, I got really interested in, well, how can we alter some of those more anti-vaxxer type attitudes, and how can we alter just general vaccine hesitancy? And so that's kind of what jump-started my interest in this line of research. And so some general questions that kind of come along with my research, can misinformation be corrected? I am asked this all the time, and it's incredibly difficult. So I really like this quote by previous researchers, which say that reliance on discredited information is difficult to correct. And there's a number of reasons for this, one of which is something that's referred to as this continued influence effect. So essentially, once misinformation is put out into the ether, so to speak, retractions rarely work when correcting that misinformation because we have an inability to update our memory. So, for example, in 1998, Andrew Wakefield published his paper in The Lancet, which he found that found that vaccines led to autism. Now we know that this paper was later retracted, but yet these sort of attitudes still persist. So it's a continued influence that that misinformation has on individual attitudes and behaviors. Of course, when talking about correcting misinformation, we also have to be mindful about how we correct misinformation. So if parents are afraid to vaccinate their children because they think vaccines might cause autism, then simply saying, well, vaccines don't cause autism, here's the research why, may not be effective due to something referred to as the backfire effect. And that's essentially the tendency that individuals have of strengthening their beliefs and their opinions in the presence of opposing or contradictory information. And the last piece of information that is really crucial to consider in my line of research are anecdotal experiences. So a lot of times what we see with vaccine hesitancy is usually based on individual personal experiences. So for example, I actually had a conversation last night and I said, this is going to be perfect for the webinar. So I was talking to extended family and COVID popped up, as it so often does in our conversations now. And this individual noted, well, I know several physician's assistants and they received their COVID vaccine and then they tested positive for COVID. So I'm not going to get the vaccine. So there are a number of different kind of logical fallacies that we could explore in that particular argument. But the important thing to note is that anecdotal experience. A lot of times individuals will say, well, I know someone who did this, or I have a family member who experienced X, Y, and Z. And what they'll do is they'll put more weight and emphasis on those experiences than they do on statistical average facts. So this kind of led into my MMR research, and I'm going to start here and then kind of adjust and tell you how I got into COVID. So with our MMR anti-vax research, or our research on vaccine hesitancy, it's actually a replicated work from some of the work of Zachary Horn and his colleagues. And what we found here is that we're essentially comparing what's the most effective way to alter vaccine hesitancy. So individuals were assigned to one of three conditions, something called a disease risk condition, which I'll show you more in just a moment, an autism correction condition, which is actually the current CDC practice for correcting MMR vaccine hesitancy, and then a control condition, which was something unrelated about bird feeding. So individuals for this MMR study, they actually, if you were in the disease risk condition, it's named this, or I refer to it as this, because rather than saying vaccines don't cause autism, here's why, the approach here is, well, if you don't vaccinate your children, here are the different diseases that they're at risk for. So individuals in this particular condition would see a warning saying that you or your child could catch one of these diseases, but the MMR vaccine can help to prevent that. There's also an anecdotal story. So we talked about how anecdotal experiences weigh more than statistical fact for a lot of individuals. So here we included an anecdotal story about a mother whose child contracted measles. Fortunately, the baby fully recovered. And then also individuals were presented with pictures of children with measles, mumps, and rubella, respectively. Now we wanted to compare this condition to the current CDC practice for MMR vaccine hesitancy. And so the current practice that they use there is what I call an autism correction, or essentially a direct correction. So rather than saying, you know, if you don't vaccinate, here's what you're at risk for, this approach says that, well, every child should be vaccinated for MMR. You may think that these two coincide with one another because of the temporal aspect. So a lot of times what we see is that usually the time when children receive the MMR vaccine is around the time when the signs of autism start to appear. And we also have noted some scientific studies in which the notion of a link between MMR and autism has been debunked. So this is mainly what we were interested in for this MMR vaccine hesitancy. What's the most effective way to alter those attitudes? And what we see in basically the overall finding is that the disease risk was the most effective condition. So in other words, if we're altering individual vaccine hesitant attitudes, rather than saying, well, vaccines don't cause autism, here's the research why, it may be more effective to say, okay, well, if you don't vaccinate, here's what your child might be at risk for, some of which could be very severe and possibly fatal, excuse me. So here the disease risk condition is the most effective, but we also see that the autism correction condition was a little bit marginal in its efficacy compared to our bird feeding group. So this is what I did pre-COVID, and then of course, COVID hit and everything that we know about normalcy completely changed. And so as someone who previously studied vaccine hesitancy, I was interested, okay, a lot of scientists are dropping everything and studying how to make a vaccine. But the next question is, how do we get people to take it? And so I wanted to explore what are some predictors of COVID-19 vaccine hesitancy, and what are ways that we can alter or try to alter vaccine hesitant attitudes. So these are the data that I'm currently working on. So I'll give you a preview of some of the pilot data I've worked on for this. So here, I wanted to kind of emphasize the parallel between the MMR disease risk condition and the COVID risk condition. So here, individuals were also assigned to one of three groups. So a risk condition, a correction, and of course, our bird feeding control. And here, the risk condition, it essentially is highlighting the same information as our MMR disease risk. So you or a loved one you know could catch COVID. You could catch it through respiratory droplets. The COVID-19 vaccine is a chance to stop the spread of the virus. And of course, we included anecdotal evidence. So this is an actual story from an individual who contracted COVID-19 and unfortunately suffered from a lot of damage to his physical organs as a result of it. He is doing well and doing fine, but still continues to recover from what we now know as like long COVID symptoms. And I also included a COVID-19 correction because we want to know what's the most effective way to alter vaccine hesitant attitudes. And here, in this correction condition, a lot of this gets at some of the, what I'll say are more conspiratorial misinformation concerns that individuals might have about COVID. So in some individuals, or some things that I've heard individuals say about COVID, they're worried about the speed at which it was produced. They're worried about what is in it, what the government involvement has in it. So these are some of the reasons that we hear for why people might be hesitant to receive the COVID-19 vaccine. So here we included just general information at the time about the recently approved Pfizer and at the time Moderna vaccines, and how that, these may seem new and novel, but these have actually been studied for a while now. They are mRNA vaccines. And so this kind of corrects that misinformation that may be out there about, well, what is in these vaccines. And so for this pilot study, I thought it was very interesting that condition actually had no impact on vaccine hesitancy. So whether we're talking about COVID-19 risk, the risk condition, or the blatant correction, a lot of these individuals, they stayed neutral as far as being pro or anti-vaccine as it relates to COVID. And so they really stayed there from their baseline, also past the manipulation as well. But some other interesting things that I also explored within this data set were just general opinions or general beliefs that individuals had about the spread of COVID. So I asked about mask wearing habits, because something that we see a lot of is that individuals who may have certain mask wearing habits or may not have certain mask wearing habits tend to have some sort of stance, so to speak, on whether or not they'll receive the vaccine. So there's a lot of overlap, and we can even see this politically as well. So the question I proposed to my participants: does wearing a mask or not wearing a mask impact you, or could it impact both you and your community? So here we see that in this particular pilot sample, that the majority of individuals say that wearing a mask can impact both me and others in my community. So that implies that they're aware of kind of the communal aspect that we have to be mindful of with COVID. I also asked about vaccinating for COVID. So for individuals who are, vaccinating for COVID, considering vaccination, does this impact only you, or does this impact both you and other individuals in the community? So here we see that, again, the majority of individuals say that, well, vaccinating impacts both myself as well as others in the community. And we also can see this when we talk about the intent to vaccinate. So when asked flat out, do you plan to get a COVID-19 vaccine? We can see that roughly about 79% of the sample said yes. But what I'm interested in, and I continue to explore with my studies, are these unsure individuals, these individuals who are saying, no, I don't want to get this. And so my research continues to explore, why is that, and what are some ways that we can alter those beliefs and those attitudes.
Perfect. Thank you so much. Very good. And then we're going to hand it over to Father Nick to continue to indulge us with his research and hear from him as well. Thank you.
So let me begin by thanking Mary for the kind invitation to present. I am technically on sabbatical this year. So I am technically on sabbatical as a visiting professor of biological sciences at the University of Santo Tomas, which is the Dominican university in the Philippines. It is also one of the oldest and largest universities in the country. It is 400 years old, and it was founded in 1611, and it has about 47,000 students. So it's a very different experience being on the faculty there. And what I would like to concentrate on is my work in the Philippines working on vaccine hesitancy. And there's a question already on the chat box, on the Q&A about vaccine hesitancy. So vaccine hesitancy is actually the technical term that is used to address individuals, to describe individuals who are not sure about vaccines or vaccinations for any reason. So we're going to talk here about vaccine hesitancy in the Philippines. And what we did is that in January, in late January, my research team, which I will describe shortly, deployed an open access survey on social media in the Philippines. We were able to get 15,651 responses in a 2-week period. And the data showed that 56% of our respondents were basically intending to receive the vaccine. So that's a 44% vaccine hesitancy. And again, vaccine hesitancy here is, we're not sure if I'm going to take the vaccine or not. We also were able to interrogate their views about vaccination in general. So vaccine hesitancy in the Philippines is not against vaccines in general. And this is important because 3 years ago, in 2017, there was a dengue vaxia scandal in the Philippines where the deployment of another vaccine against dengue led to the illness and death of some of our young people. And so, as Dr. Capley pointed out, a lot of people will rely on the most recent memory. And so we wanted to figure out whether or not the dengue vaxia would undermine their confidence in vaccines in general. But it turns out that 80% plus our respondents believed that vaccines in general would work. However, they also revealed that they were deeply worried about specific aspects of the vaccines. Now, something striking, which I don't think you would expect here in the United States, is that in the Philippines, my homeland, 98% of them are worried about fake vaccines. You really don't hear about that here in the US, but in the Philippines, this is a concern for many, many reasons. You have vaccine side effects, vaccine safety, vaccine efficacy, and the vaccines were not tested properly. So there are very concrete concerns that our Filipino respondents have raised about this vaccine. Now, we also, unlike again here in the United States, we have an extensive vaccine portfolio. The reason being, of course, is that the significant portion of the vaccines in the world have been reserved for the European and American and European Western countries. So the rest of the world basically is scrambling to get vaccines from wherever source they can get it from. And so we wanted to ask our respondents if they had a preference for a vaccine made in China, in Russia, or in the West. And what you see is 50% reported no preference, but a significant number wanted and only wanted USA or European vaccines. And there are reasons for this that we can discuss in the Q&A if anyone is interested, with regards to recent history of drugs used in China that were tainted in some way when they arrived in the Philippines. We also wanted to identify the source of their worries with regards to COVID-19. And what is really striking about Filipinos is they worry more about their families than about themselves. So there were 2 questions in place to determine whether or not it's self or family concern that was driving their concern about COVID-19. And what we saw is there are clear numbers where our Filipino respondents were more worried about their family than they were worried about themselves. Now, we also wanted to look at the environment and the social influencers that would influence their decision to take a vaccine. So 77% said that they would be willing to receive the vaccine after many people receive the vaccine, and 71% agreed that they would receive it after politicians receive the vaccine. Again, I think it is, this is so different from the American experience. I just can't imagine that 71% of Americans would say that they would wait for their politicians to get their vaccines before the citizens would. But again, there's a distrust over the sources of these vaccines, the efficacy of these vaccines, and the concern that corruption is driving the vaccine strategy, which is why they would want the politicians to get it first, just to prove that they were in fact safe and efficacious. So based on our data, which we are actually writing up with Dr. Capley, we thought we basically, looking at our data, we proposed that we could build a vaccine awareness campaign that would target very specific concerns about safety and efficacy of the COVID-19, that would also emphasize the need to vaccinate not just yourself, but your families. And then what we wanted, given the Filipino need to know that other Filipinos were also being vaccinated, we wanted to build up basically just enormous numbers of personal testimony. So kababayan is a Filipino word for fellow Filipino. There's no real word for that in English. You don't have a word for other Americans, but in the Filipino language, there's a specific word. Kababayans means those who live in the same house as you do. And this is the term that is used for other Filipinos, no matter where they are throughout the world. So what we've done is we have set up in collaboration with, I have 30 undergraduates at the University of Santo Tomas, and together we have set up the USD COVAX response. So they are masters at social media. So this is a social media campaign. We set up a logo. So this is a logo of our campaign, and I will translate the Filipino line there. It's like the bite of it's only like the bite of an ant. So the idea, and this is actually Filipino folklore. Ever since vaccines were introduced in the Philippines, the idea was that your parents would tell you when you went in for your vaccine, it's just like the bite of an ant. And this is a very specific ant. This is the red fire Filipino weaver ant. I actually went and talked to an entomologist to identify the ant that every Filipino is aware of, and then we got an artist to depict that. And so these are my students. They're Filipinos. They're the third year biology students. There are 30 of them. We have never met because the Philippines has been basically in lockdown since last year. And because our senior citizens live with our families, we do not have any nursing homes. We do not have anything like that. It's intergenerational. 60% of our homes are intergenerational. In order to protect our elderly, what we had to do is we had to shield them by preventing the young people from going out. So, just to give you a perspective on the effect of the pandemic, for Filipinos who are 16 years or younger, they have not left their homes since March 15th, 2020. So they have not been allowed to leave their homes in order to protect their grandparents. And again, this is the entire society is together in protecting our grandparents, because in our culture, our grandparents are they are the protectors of our memories and the traditions of our culture. So what we do is we publish science-based infographics to address the concerns of the Filipino. We talk about efficacy. We do this. We also do it in Filipino. So we do it in bilingual, both in English and Filipino. This is just to describe what the vaccines do. We send this out, and then my students have developed networks for all the other universities in the Philippines, and we're deploying this and flooding social media with this. We also got testimonies. We call these COVAX testimonies. We contacted healthcare workers, Filipino healthcare workers from all over the world, from Australia, from the Middle East, from the United States, from the United Kingdom, and we invited them to send their selfie as well as a testimony. And we're flooding social media with this. We want to, again, our view is you've got to show Filipinos that other Filipinos have been vaccinated so that they will feel that this is something that they can do as part of the collective. So just in conclusions, We have deployed a public awareness campaign that is ongoing in the country. It is based on, one, appealing to the brain of the Filipino. It's science-based information to correct the misinformation. And you see this with Dr. Capley's work as well. It's a direct response talking about what would happen with long COVID. So we had concerns about getting sick, and then the concerns about protecting your family. But then we also have, again, data-based evidence that is accompanied by personal testimonies that appeal to the heart of the Filipino. And so we have both of these ongoing, and my 30 students are working nonstop just to flood social media with this. And people will email them, and they will, well, text them on Messenger in order for them to ask specific questions. And they're in there just doing the research to respond to these, to their fellow Filipinos who are asking them questions about COVID, about right now ivermectin, which is very hot in the Philippines, as well as the vaccines. So thank you so much for your kind attention. I'm sure that we can have an interesting conversation moving forward.
Thank you, Father Nick. Appreciate your time. So we have some questions that have come in through the Q&A, but I'm curious. I thought we'd start with this question. Is there a question that you are always asked? Is there a question that is the number one question that is at the top of people's minds when it comes to this, whether it has to do with the vaccine or whether it has to do with masks or whether it has to do with geography? Is there something that you can count on being asked? Alex,
do you want to go first?
Yeah, the question I'm asked two questions. One is, well, why are people vaccine hesitant? Which I'm like, well, how much time do we have? So there are a number of reasons. It could be based on credibility, whether you believe whoever's making it is a credible individual, whether you reason based on scientific reasoning or have other types of directional or more purposeful type of reasoning in that regard. Another question I'm always asked is vaccine hesitancy new? And it's not. So I always think it's interesting that in the US, there have actually been citations of anti-vaccine attitudes. And I use that specifically because individuals were opposed to the use of vaccines rather than being, I'm unsure, I'm hesitant about it. And so what we actually see for the US is that in the late 1800s with the smallpox vaccines is that there was actually an anti-vaccination group that was created that wanted to go against the mandates of the smallpox vaccines. So I'm always asked, is this something new? And it's interesting that it's not, and yet it's novel in the sense of, I think, how widespread some of that vaccine hesitancy has become.
So in my case, I get asked this question, which is the best vaccine I should get? And I tell people, it's the one that is being offered to you today. And I am speaking in the context of the Philippines. We do not have vaccine choice because this would be a completely different subject, right? So the West, because the West has basically reserved significant amount of the vaccine supply, a country like the Philippines has no access to vaccines. So for example, just to give you a contrast, we have now vaccinated over 100 million Americans with at least one dose. We have only vaccinated in the same amount of time the equivalent of about 400,000 Filipinos, simply because there are just no vaccines. And we are actually waiting for the American rollout to be completed, because only after America gets its people vaccinated will the vaccine supply be released for the rest of the world. Now, this is another subject of conversation. It's basically vaccine hoarding. And I'm deeply, deeply troubled by the vaccine hoarding that is occurring in our country here, We have tens of millions of doses of AstraZeneca that are currently in storage in Ohio. And AstraZeneca is not even approved for use in our country. And yet the United States, just in case, right, just in case, is storing these. So the reason why we have vaccine choice in our country is because we have such an excess amount and so that's part of the thing. So I get that. And the second I get right now actually is about vaccine passports, because it's very controversial in our country about vaccine passports. What most Americans are not aware of is I have had a vaccine passport since I was 4, because many people in the developing world, as soon as you travel internationally, are required to get a vaccine passport. So I have a vaccine passport against yellow fever and polio, because both of those are required to enter the Philippines. So it's, again, I just want to, it's just to broaden the context of the conversation to a global perspective. We just have to realize that vaccine passports have been around for decades. They have never been controversial until today. So we have to have a conversation about what are legitimate restrictions on the use of vaccine passports, but what are also appropriate uses for vaccine passports.
Thank you. One of our guests is asking about, are there options to the vaccines? Do you think there will be options to the actual vaccination?
So I can, there are individuals who are opting not. So I'm in the process of making an oral vaccine. That's part of the work. The reason I am back in the United States for these last few months has been to develop an oral vaccine based on a yeast delivery system to take back to the Philippines with me. So there are individuals who consider injectable vaccines very different from oral vaccines. The sense of they associate vaccines primarily with injections. So the fact that you could take this oral vaccine, mix it with your milk, mix it with your beer, and then chug the milk or chug the beer, for a lot of people, this is not a vaccine. They'll be willing to take that. So there's that option. But for those who don't want to be vaccinated at all, our goal is to get to herd immunity. And there are estimates between 70 to 85% of the population has to be vaccinated. So we can accommodate individuals who are not vaccinated. That's one of the reasons why we are targeting herd immunity. And again, the concern is that if not enough people get vaccinated, then we would not be able to attain herd immunity. Are there drugs to help people prevent getting COVID or to treat COVID early? Yes, there are, but they're not 100% effective. So, but there are people who are doing that research right now, and we pray that we will be able to treat COVID in the way we treat other things.
Great, thank you. As a follow-up to that question, one of our guests is asking, why do some people assume that one vaccine is better than another? Or is more effective than another? So again, that's a bio question. So that's because what's interesting is since November, when the first clinical trials came out, these clinical trials were associated with efficacy numbers. So you have Moderna and Pfizer at 95%. AstraZeneca, depending upon the interval between the first and second dose, it can go from 60% to 85%. Sinovac is 57%. And so when you throw numbers at people, they're going to start comparing these numbers. What they don't realize is that these numbers are not, they're not based on a standardized system. So it's like saying, okay, I got an 85 for English in this country, but I got 85 in another country. The grading systems are not comparable, which is why it's so difficult to really compare efficacy. I explain to people that choosing a vaccine is like choosing a car. Do you want the leather seats? Do you want the GPS? Do you want the red dashboard?
there are different characteristics of each vaccine, and you have to figure out which one you want. So I'll end with this. We have variants in the Philippines, and so the variants are a particular challenge for us. The Pfizer and Moderna are sensitive to the variants, but the Sinovac appears not to be as much. So even though Pfizer and Moderna are at 95% efficacy, the Sinovac only at something like 65, it has broader protection, it seems.
Great, thank you.
And can I actually follow that up specifically with Johnson & Johnson? So as we relate to vaccine hesitancy, regarding a lot of times people are concerned about the process in which they're made. And so one of the things that might be most salient for some individuals about certain vaccines, recently Johnson & Johnson just had a big mix-up in which a huge pile of their vaccines was mixed up with another component. And so they had to essentially scrap the pile. And so when individuals may be going to get vaccinated and they're thinking, okay, I have these options, if those options are available where they're at, that might be something that's salient in their mind, which also may make them a little more hesitant for some vaccines compared to others.
As far as kind of the life of the vaccine, we have one viewer who's asking if we have any information yet about how long the vaccine will last. You know, when will people need to be vaccinated again?
So given that we only started vaccines in December really, and not counting the clinical trials, what we know is they last at least, the immunity seems to be holding for the last 6 months. Now we have to go for another year in order to see if it lasts for a year. The data from the other coronaviruses, so there are 4 common coronaviruses that are responsible for the common cold, for example. The immunity against those coronaviruses only lasts a year or year and a half, which is why we anticipate that the vaccines will probably last only a year and a half, which is why this is going to become another flu shot. You're going to have your flu shot and you're going to have your COVID shot pretty much every year, every other year.
So expanding on that, we have a question. Some vaccine makers are continuing to develop their versions of the vaccine. So do you believe that that a vaccine that's developed within a longer time frame will be more effective? You spoke before about how there's hesitancy with how quickly this came together.
Now, I speak as a biologist, so people misunderstand the length of time it takes to develop a vaccine. One of the essential components for developing a vaccine is a clinical trial where individuals who've been vaccinated and individuals who have not are exposed to the disease. So for example, if you're developing an Ebola vaccine, you have to wait until the next Ebola outbreak before you can test your vaccine. And so sometimes it can take years for you to wait for your Ebola next outbreak because Ebola is so rare. For COVID, it's been just go to Florida, just go to California, go to Michigan now, where they're having a spike. So one of the reasons why it's been so, the timeline has been so abbreviated is twofold. One is enormous amounts of money were thrown at developers of vaccines by governments who were desperate to save their economy. And second, because it's a global pandemic, you could easily find 44,000 people that you could include in a clinical trial, and then within a matter of a month, expose them to COVID-19 to see whether or not they would get it. So that's why you see the shorter time actually has nothing to do with they cut corners, they took shortcuts. It was just the nature of a pandemic and the kind of global pandemic that we are still going through.
Thank you. We have a number of questions asking about the kind of the negative connotation of the vaccine and the side effects of the vaccine. It's particularly the vaccine and how it may or may not affect fertility or birth defects. This particular guest is asking, can you speak to how we can counteract this thinking?
Yeah, so this is where that reliance on discredited information gets really difficult to correct. And there's also, one of the things I always like to preface individuals with about science is that good science changes. The more we learn about novel things that we encounter, the more we will adjust our viewpoint, the more information we find out about it. So sometimes think about a year ago when we just found out about COVID and all of the different practices and things that we've changed over that past year as we learn more and more about it. So one of the things I like to start with is that, just saying this is new in a sense to us, of how widespread it is and how we're all impacted by this. But the coronavirus as a whole, much like Father Nick said, there are different types, there are different variants that have been studied and have been explored. And so the first thing I always like to address when trying to alter any sort of attitudes or just trying to understand where people come from. So just saying, so what are your concerns about this vaccine? So, and a lot of people will say, well, I don't know what it'll do. What I hear a lot of is, well, I know such and such got it and then this happened, or they tested positive, or they had side effects. So a lot of times some people can just be fearful of those unknowns. So for example, one person that may receive one vaccine may not have any side effects from receiving it, which of course we all know the side effects are just the body's way of responding to it. So it's doing what it should do. But what may affect one person one way could affect someone in a totally different manner. And so what we see a lot of times when we talk about any form of hesitancy or some sort of, I guess, fear of the unknown is usually that uncertainty component of, well, what is happening exactly? And so with this particular approach, I usually like to see, well, where are people coming from? What are their concerns? What can we address empirically? So what has been studied and assessed by science? What can we address in that regard? And also seeing if these individuals have any sort of anecdotal experiences that they are weighting their decision in. So that's usually my first component that I like to start with.
I'd like to add to that. I think one of the challenges we face is that people are not used to evaluating risk based on statistical information. So, for example, there's been a lot of talk recently in Europe about the risk associated with the AstraZeneca vaccine with a particular form of blood clots in the brain. And so when people speak about this to me, they're saying, well, we heard that there were 32 blood clots out of 18 million people. So now one of the things I point out, for example, is that it is clear that the risk of blood clots from the contraceptive pill is significantly higher than the risk of blood clots associated with the AstraZeneca vaccine. And when I point this out and I tell people the numbers, especially women, they'll go, oh, because what has happened is that they're like, I'm willing to take that risk. That risk to me has been very minimal when I'm on the pill. So if that risk is minimal for me on the pill, then it should be minimal for me with regards to the AZ vaccine. So I think what one of the challenges is that we have to take this unfamiliar information, especially this numerical information, and relate it to the lived everyday experience of people in order for them to have something to compare it to. Because they don't know. I mean, so again, my mother was on the phone with me the other day on FaceTime, and she was saying, look, I found out that there was this one person who was doubly vaccinated and she got COVID-19. And I said, Mom, that's actually called a breakthrough infection. Now, did you know that was 1 in 45 million? The reason why she's so popular is because there's so many millions of people. She goes, oh, I said, that means in a country like the Philippines of 110 million, 3 or 4 people in the entire country will get breakthrough COVID. When you put it that way, they're like, why was I worried? But they were not, again, it was not framed in a way that they could understand.
Thank you.
Yeah, that actually, you're bringing up so many other points that yeah, absolutely. So one of the things that I talk about in my Psych of Misinformation course is about how people reason. And so one of the things that Father Nick was getting at with, how we break down statistical numbers and scientific numbers, a lot of that too can be based on how people reason. So we have to be mindful of if individuals are reasoning based on accuracy. So I ultimately want to come away with a logical, correct conclusion, or if they're based on directionality, which is essentially, I only want to do something that results in some sort of desired outcome. And I think about that in my conversation last night, in which we're talking about the anecdotal experiences of, well, I know someone who received the vaccine and then they tested positive. We could talk about how correlation doesn't lead to causation. We could talk about, well, what else were they doing aside from that? But one of the things that if you talk to people who are extremely hesitant and in certain regard, is that sometimes if you adjust their concern with something else, we're saying, well, okay, it could be possible that this happened because of maybe it was a breakthrough case, which would be extremely rare, or it could be that they did something else prior to. Then you'll notice that usually they'll jump onto, well, I also have concerns about this. So you're really kind of breaking apart multiple concerns when we talk about vaccine hesitancy. It's usually not just like one concern, but it's a lot of overlapping concerns that tend to entwine with how one reasons.
So when we end, I hope that each of you will be able to maybe share kind of a parting thought with the group. But before we get to that, I do want to ask about masks, because there are some questions about masks. And I think, and the specific question is, do masks, have a positive effect? And you hear so much about masks these days, different kinds of masks. I heard earlier on the news that I think there's a Massachusetts school that is asking kids to come back with 2 masks. Can one of you talk a little bit about masks and kind of the psychology or biology behind the masks?
So I'll start with the biology and I'll hand it off to Dr. Kapley for the psychology. So we have not been able to do the definitive kind of double-blind random tests that you would want to do to get the definitive data on this, simply because it's a pandemic. I think the best way to understand how a scientist approaches this is the following. We know that the primary way of transmission of this virus, because it's a respiratory virus, are water droplets. And so from the very beginning, we are already predisposed to think that if I am prevented from expelling water droplets, that I would in fact mitigate or minimize transmission, because we already know that. Then we have correlative data from so many places. For example, you can have states in the United States that mandated mask wearing, or even interesting, within a particular state, there would be counties that would mandate mask wearing and the adjacent county would not. And we can see the correlations where as soon as the mask wearing is mandated, the transmission rate begins to plummet, while in the county next over, where they have not done that, it continues to rise. So we have correlative data, and that suggests strongly that the intuitions that a biologist has, knowing what we know about the transmission of the virus through water droplets, is in fact supported by the evidence. Now, a lot of people will raise, for example, the question about Denmark. There's one study from Denmark that highlights that they were able to show that people who were wearing masks were equally likely to get sick. There are also studies in Korea, for example, where you have an entire Starbucks in the local town. One person goes in, everyone doesn't get it except the 2 who are, everyone gets it except the 2 who are wearing masks. So you have studies like this that support the claim that that masks actually prevent that. Now, in the Philippines, again, because we are a poor country, we do not have the testing capacity that the United States has. So you are required not only to wear a mask, but also to wear a shield, because it is clear that the mucosal surfaces in the eyes prevent the entry of the virus. So again, are there definitive studies that involve thousands of people with and without masks or with and without shields? No, because we can't do that in the middle of a pandemic. But again, the data is there to support the high likelihood that it's effective. And here's the thing, right? The way the Filipinos do it is, if it has a chance of preventing my grandmother from getting sick, why am I not wearing it? So you see, it's not like you have to prove it to the Filipino that they have to wear it. If there's a chance that I will protect my grandmother, whom I love very much, who is at high risk because she's 80 and has diabetes, why shouldn't I wear it? That's the view in the Philippines, which is very different, of course, from the perspective that we have here in the States.
Oh, it's a complete stark contrast. There, it's like, do this for your elders, do this for your grandmother. Here, it's like, well, why should I have to do that? I'm fine. So we do see those differences, absolutely. And I'm so glad that you mentioned, so I was going to talk about some of the articles I know that have explored, just kind of like a general review. But of course, much like Father Nick has mentioned, there's not going to be a definitive, double-blind, empirically, sound tested, manipulated study like that during a pandemic. But there have been researchers, both in the States as well as internationally, that have looked at the spread of just those water droplets, those respiratory droplets, with individuals without a mask and individuals, like how it's protected with a mask. And so there have been some reviews that some studies that have supported the notion that mask wearing does decrease it. But much like Father Nick mentioned, we don't have anything along those double-blind, experimental, manipulated control studies currently in the middle of the pandemic.
So as we wrap up, I want to thank you both for sharing your insight tonight. Is there a parting thought that you can share with us as we all head off into our evenings?
So I'm going to end as a priest. One of the questions I do get a lot as a priest is the following: why did God allow the pandemic to hit us at this time? And this is the same question I get when I'm helping people to die. When people who have cancer, people who have ALS, when I as a priest have to go to their bedside and they're wondering, why do I have to suffer? Why is it so difficult? And the Christian response is, we do not know why you in particular are struggling with this heavy cross. But this is Easter. And so it has been an incredibly challenging year. The hope here in the United States is that the light is very clear at the end of the tunnel. We have pockets of herd immunity that are building up. My hope and my prayer is that by next fall, PC will be its normal, rowdy, crazy, Eaton Street party self. But until then, we have to pray, right? So not only for ourselves, but I ask especially for those people around the world who have no access to the vaccines, and therefore who will have to endure the pandemic for another year or two beyond this year. So there are countries where we anticipate the pandemic to last till 2024. In the Philippines, we're anticipating this pandemic to last till 2022, probably the summer of 2022. So we are incredible. If we talk about privilege, we're incredibly privileged and blessed here in the United States. And I ask that you pray for the world, for the people around the world who will suffer for it a little longer. and that all of us will get through this incredibly trying situation. Hopefully a little stronger, a little more self-reflective, and a little bit more patient with our neighbor and with ourselves.
It's like you took the words right from my mouth, Father Nick. Absolutely. It's been a tough year. And I would reiterate the same, that we just need to continue to be patient and continue to, consider all the others and consider, we've been through a lot this past year. And much like Father Nick said, there's still so much to be fortunate for and to keep in mind and consider. But there is a light at the end of that tunnel. We just have to hang in there, be a little bit patient for a little bit longer.
Well, I want to thank you both for joining us, and I also want to thank our regional volunteers for joining us as well. This has been informative and inspiring, and I thank you both for sharing your expertise with us in the fields of biology and psychology. And I hope everyone is safe and healthy, and take care. Thank you.